Welcome to the Medicare Cafe show. As always, you're joined by your hosts, Olivia Richardson.
And I'm Mike, and today we are chatting about marketing to pharmacies because we've always said go to where seniors are, and 89% of seniors take some sort of prescription medication, whether it be 1 or 50, they're on a prescription medication. So that's where they're going, and that's where you should be.
I honestly think pharmacies too, especially the mom and pop. When we're talking about pharmacies, we obviously want to talk about the big brand names, your Walmarts, your Walgreens, your CVS's. But I think for a lot of these intensive purposes, I want to target those mom and pop pharmacies because they're going to be extremely open to having new partners and new networks. Mom and pop pharmacies, you guys, they're hurting right now for a couple different reasons. We're seeing a lot of, again, the delivery of certain pharmaceuticals and the tax breaks and the incentives to get into the pharmacy industry. The mom and pop shops are not getting those tax breaks. They don't have the capability of being able to manage everything that it takes to be the CVS, the Walmarts, the Walgreens of the world. So and not only are that, but because of COVID-19, because of all these things, you're seeing a ton of push towards mail order options. And mail order options, as we know, they eliminate that middleman. Those mom and pop pharmacies do not have the resources that the big box name or the big brand name stores have in order to work with the mail order option. So mom and pop pharmacies, you guys, they're hurting. They're going to be they should be, in theory, I'm not going to say they're going to be, but in theory, they should be really open and really receptive to new partnerships because they're going to be doing really whatever they can to maintain and save their business.
Yeah, and you're going to find them in smaller communities. In Kansas City, St. Louis, Chicago, larger populous areas, you're going to be overran by the Walgreens, CVS's, grocery store chains. When you go to smaller, more rural communities, where you don't have the Walgreens, the Walmarts, the CVS's, you're going to find the mom and pop pharmacies because they got to get their drugs from somewhere. In fact, even here in Columbia, we have a Walgreens. We got a couple grocery stores, we've got a couple Walmarts, and yet we still have a couple mom and pop pharmacies here and there throughout Columbia. So even in your mid-sized towns, 100,000 plus, you could still find those little mom and pop places existing. And of course, they would love more business, which you could help provide them. But most important, it's not what you can do, not what you can do for the pharmacy. Wait, I'm reading that completely backwards.
You're trying to make it with like the political, not what you can do for not what your country can do for you, but what for your country.
We speak good for a living.
Yes.
Yeah. It's not what you can do for the pharmacy.
Yeah, it is what you can do for the pharmacy. It is not what your pharmacy can do for you.
Not what they can do for you. Because that's the thing is they don't care about your book of business. They don't care about you getting more sales. They've got prescriptions to fill. They've got doctor offices to double check things on. They got insurance companies to call and argue with about refilling and dosages and everything else. They don't have time to sit there and run Part D lists or talk to people about Part D. And I guarantee many pharmacists don't understand Part D. That's what I run into all the time. They're like, I don't care. It's not my thing. I got to worry about, all these pills and Myrtle asking about, can I take this pill with this pill? And, where are the foot braces? And I got to stop and show her where they are, yada, yada, yada. They don't have time to run drug lists like the, Walgreens commercial where the pharmacist is sitting there talking to the woman like, oh, yeah, that's a great question. They're like, look, lady, move on. I got pills, all right? Go. So make sure that you are making about helping them, and in return, you're going to hopefully have that reciprocity of you're helping us, so now we're going to help you.
Well, it's more so, again, it's we're looking at any type of referral partner. When you're looking at any type of networking partner, it's very much they have tattooed on their forehead, what's in it for me. So you have to build that relationship. You have to gain their trust. And truly, what is the incentive of them to send business to you? The incentive is, you'll be able to urge clients to go to their local pharmacies. You'll be able to urge clients to see the value, as long as there is value. We're not trying to sell something that's not true, but being able to help sell on your local pharmacies to help clients see the value and working with the local in your local community. You'll be able to help steer clients towards plans that accept that pharmacy in network, things like that. So making sure that you are really, and again, consistency is going to be a huge point. If you go into the pharmacy once, throw down some business cards and say, I love to have your business, that's a waste of your time. You're not going to get anything from that visit. So making sure that you're doing, monthly emails, monthly phone calls, buying them lunch every now and then, but just making sure that you're staying top of mind. So whenever the pharmacy has insurance related questions or insurance related need, you're the first person they talk to.
Yeah, and a lot of these smaller towns have very close-knit communities, so it does help to be known in that community. If you're not, you can't just drive to a rural market and expect to be welcomed with open arms. They're
Right.
very close-knit. These big city slickers coming in. What do you want? You just want to sell us insurance, and that's it. It does help to be part of the community in some form or fashion. It's
Mhm.
also important that when you start advertising or talking about larger carriers, United Healthcare, Humana, Cigna, etc., they're going to be very keen to, well, they push mail order, and mail order takes us out of the equation. So make
Mhm.
sure you're talking about, I tell my clients to come in to make sure they get the best service and are not guessing what pills they should take and when. They could talk to a real life human that actually cares. So
Sure.
having some sort of spiel does help to say that I'm not pushing mail order, I'm pushing quality service and connections.
Mhm. Yep. So
Now,
there
if you're
are
like,
some.
go ahead.
Go ahead. No, you go ahead. I'll shut up.
I was going to do the next slide.
Yeah, that's what I was doing.
Okay, good. So, let me click. There you go. So we've got a couple different flyers. This is one from the National Association of Health Underwriters. It is you can personalize at the bottom where it says for more information, contact. My opinion, it's a little busy. We've got another one that we'll show you here in a second, but this is the kind of materials you could drop off for the pharmacist. Say, hey, here's our Part D works. I know it's complex. If you have a client or a patient or whatever they refer their patients as or customers as, you could say, here's my business card. I'm happy to answer questions over the phone for either your staff, or any of your clients that come in, and just be that resource. Say, hey, here, let me help you get Myrtle away from you, talking about her back pain and the surgery she had in 1942, and let me take care of them so you can go about your day.
Mhm. Oh, exactly. And I think you're kind of leaning towards the next one. In my opinion, this is something that is not consumer facing. This is going to be more so for the pharmacy to have on file, not on file, but to have shown, to have like posted somewhere. I like this one better. It's easier, it's cleaner, it allows for more branding. I would much prefer that you brand yourself as the client or as the agent. I'm not so much worried about branding it with Nehu because the average person, a consumer, doesn't know who Nehu is. But I really like this. It's simple, it's clean, allows for personalization, allows for that branding. But again, this is something that you can absolutely hand out to a client. I can't imagine a client ever referencing back to this outside of being at the pharmacy. So giving it to your pharmacist and having them posting it somewhere, having it to where they can answer questions based on this flyer. And what I love that you can say is if you have additional questions, exactly right up there. If you have additional questions, please feel free to reach out to me directly. It's a great call to action, great, very basic, minimal information, covers those quick one-off questions, but still has a call to action to reach out to you.
Yes. Now, infamous question, where do you find this? Great question. It's on our website. We'll show you here in just a second. But this is something I've seen agents take previous years we've done and laminate them and tell them, hey, post this on your wall so where the customers can't see, but you can. So if someone has a question, it's a quick reference point. Do
Mm-hmm.
that if you want, not however you want to pass it out, go nuts. But the fact you're leaving something tangible other than a business card, an actual resource piece, may help you stand out from everyone else that visited them that day trying to peddle something, whether it be drugs, machines, whatever else they use there.
Again, you're providing value, you're providing information, and I loved it. Another piece that I know we have really promoted. And again, it is something that is only available to agents who have at least one contract with senior marketing specialist you have access to. It's through our AMP program, Agent Marketing Portfolio. And it's really cool. It's a folded one, looks very professional, but is a drug tracker, a pharmacy tracker. And the client puts all their immunizations in there. It puts a list of all the medications that they're taking. It's really nice. Pharmacies can have them. They are branded towards the agent, but they're wallet sized so that they can go in. If, for example, they go to their doctors, they no longer have to bring a list of their medications that they're on. They just bring in this medication tracker. It's nice for the pharmacist to help track so they can look at their current list of medications to see if that medication is going to interact with anything else that that client is taking. So it is something, again, helps promote the carrier, or not the carrier, help promotes that pharmacy as an added little resource, add a little tool the pharmacy can give their clients, and it promotes you. It's a really cool piece. It's on the AMP program, Agent Marketing Portfolio.
100%. And I had a conversation last year with an agent. He was like, I have all these marketing pieces and they keep throwing away. See if you can co-brand it. If they see their name on something along with yours and you offer to do all the printing and such, like that drug tracker, that may help them, entice them to pass it out. Because if their name's on it, they're going to take some ownership. If only your name's on it, then they'll be like, this is your junk. It's not as important to me. So if you could do some co-op with the pharmacy, that would be outstanding. But we talked about mail order again. Push to say, hey, I'm here to get people to come to you and get that higher level of care as opposed to just a random mail order. And who knows, we've seen people steal, drugs off people's porches, stealing Amazon packages, et cetera, et cetera. So, that could be very detrimental if someone's in need of medication and someone takes it from their porch or from their doorstep. This is a way to get around that. So I'm not saying use fear tactics, but it is a very real thing that happens.
Yeah, it's more or less just letting them know what the risks are. Is it more important to you for that security, or is the convenience more important to you? Having those conversations.
Yes, you're welcome, Brian. Like Olivia mentioned, this isn't done in one visit. You can't just show up once and be like, hey, I'm here to have a great relationship. It's almost like dating. You don't go on one date and be like, what are we wasting our time for? Let's just get married next week. That very rarely works. Most of the time, you got to build that trust, find out about them. Are they a great, outstanding member of the community, or are they burying bodies in the backyard? You want to know that before you start going and having this relationship and this referral network with them. So make sure you take that time. Like Olivia said, keep on going back. Maybe do the candy dish. Maybe drop off extra flyers. Maybe if you get additional resources, feel free to drop them off and say, hey, look at this. When I was with Humana and I had a booth there at Walmart, I would always bring in donuts, and they weren't allowed to take donuts. They said, we can't accept any gifts per company reg. So I would walk in with my donuts and say, I found these in the parking lot. They must be yours. And they would take them and be like, well, if you're not giving them to us, then, I guess it's okay if we just found them. I said, yeah, so I'm thinking too. So kind of being comical like that, I'm not saying I was getting on the rules with them, but they appreciated the little twist on that, and they appreciate the donuts. So stuff like that can definitely help. And who doesn't love a donut? I mean, come on, let's be real.
Yes. Great question. Jay asked, how do we sign up for that drug tracker? Again, two things you can do. Either if you have at least one contract with senior marketing specialist, you have access to our website, go to, there is a tab on there that says like services. Scroll down, it'll say AMP, Agent Marketing Portfolio. Click on that and you can pick out which drug tracker you'd like. Or if it's easier for you, just call our office, talk to our agent resources team, and they will make sure that you get access to that AMP piece as well. If it's easier, if you want to do some searching, it's under services and our website, or if you'd rather just call and talk to us, ask for agent resources, they'll get you to the right place.
Yeah, and the biggest thing is don't be a pest. It says persistence versus being a pest. Persistence is being a good resource. A pest is being, why aren't you giving me referrals? So just make sure you're working with them, not against them. And you can find both of those things that we looked at, both forums, in the MA PDP AEP toolkit that's still active on smsteam.net. So I realize AEP's over, but that doesn't mean we stop selling. So that just go to that toolkit, and in the marketing section, you could download those right away.
Pam asked a great question. She goes, how do you build this relationship with a pharmacy when you're selling Advantage plans that do push mail order? I guess the question is, are you pushing mail order or is the plan pushing mail order? We work with a really great agency out of Mexico, Missouri, and their pharmacy actually set up an office and will do radio advertising because the value that they see is just, helping clients. We don't want to handle these questions. We keep getting inundated with questions. We want to give them the resource to answer those questions. So even if it's not like I'll push the business to come to this pharmacy, because that pharmacy may not be the best course or the best place for that client. You want to do what's best for your client. So just making sure is, what are you advertising? What are the services you're advertising towards that pharmacy? Again, do you want to spend time answering Myrtle's questions about her Part D plan, or would you rather me answer those questions? I can't answer those questions, and I can't check on, why is this drug costing more than it did last month? Why is this doing? I can't check on those answers unless that policy is through me due to HIPAA violations. So if you want me to be able to service your clients and answer why their drugs are costing what they're costing, let me, make sure that business runs through me and I can answer those questions.
Yeah, and that's, people tend to be loyal, and we always say look at their P&C policies or auto and home. They may have had the same policy for 30 plus years. Because they're loyal, they like that. If they're loyal to that pharmacy, the pharmacy's doing a good job, and you're advocating for that pharmacy, they're hearing it from multiple sources, they're more likely to ignore the mail order things coming out. So that's part of the spiel too with the pharmacy, saying, hey, I'm on your side. I want people to come here to get that higher level of service. And I also want to be part of your resource team of when Part D questions come up, I'm happy to just answer questions, and
Yeah.
that's it. And just be a local resource. And if I can help them, great. If not, no big deal. And you
Yeah.
go with that attitude, they'll be much more receptive, as opposed to, I really want to sell people crap. Please send people to me.
It's more so just finding out what's important to that pharmacy. What's really important to that pharmacy may not even be on the radar for another one. So it's just having those personalized conversations, just like you're doing with your clients. It's the same idea. Lee, I want
Yes.
to answer your question, but I want to wrap up this topic first, and it looks like we have. So, Mike, I'll let you go ahead and talk about Medicare Cafe Live, and then Lee, I want to answer your question.
Yeah, absolutely. So this Friday at 9 o'clock on the Medicare Cafe Facebook page, talk about getting organized. Because if you've been part of the cafe for a minute, you know that I have bought probably 4,000 organizers in my lifetime, and about another new one, because why not keep that? Why that streak's not going away? So we're gonna be talking about organization, not only with paper and digital, but also about CRMs and such, and just getting organized and helping with that. So I'm gonna share my experiences. Hopefully you share yours, and just join us for a couple minutes, 9 o'clock on the Medicare Cafe Facebook page. So
Again,
yes, Lee had a great question.
yeah, to access the Medicare Cafe Facebook Live, make sure you just go to facebook.com. In that search box, put in Medicare Cafe. You'll see the Medicare Cafe page. Click like, click follow on that, and then you'll get a notification every Friday whenever Mike goes live. If you don't get that notification, no worries. Just go to our Facebook page at 9 o'clock and you'll see Mike's brilliant, shining face. Lee, to answer your, and then we're at the point now, I'm going to stop recording. So if you're watching the recording, bye.